My name is Mackenna. I'm going to be doing your ID today. What's your name?
Sitlali.
And what's your birthday?
June 13th, 2002.
And then do you have any allergies?
No.
Do you take any medication?
No.
Okay. Are you pregnant?
No.
Okay. So we're going to get started in just 3 minutes. I'm going to get all of my supplies together, okay? Alright. So I have my gloves. I have my transparent sticky tape, which I'm going to open. I'm going to make sure my syringe is open. That has my saline solution inside of it. And then I'm going to make sure I have my needle open as well. So that is nice and ready for me. I'm also going to open up my tubing. I'm going to tear that open, but make sure that I'm not touching any of it. So I'm going to take the purple side out first.
When you're all done, you just throw all the supplies away. If it's got blood in it, like
I'm going to take the white top off without using the plunger side.
And then just kind of clean up the area. I'll take care of it.
I'm going to attach, so I'm going to push that in, and I'm just going to twist this on. And then I'm going to take this out, just so I can test to see if I have any bubbles, and I want to clear all the bubbles out. So I have one bubble right there, and we're clear, which is good. So this is nice and ready. I have my alcohol prep pad. Alcohol prep pad. And I have my tourniquet, and then I have my gauze for afterwards. I also have my tape. I'm going to split into strips. So the first thing I'm going to do is I'm going to wash my hands, and then I'm going to put on my gloves. So now that I have my gloves on, I'm going to take my sticky and I'm going to open it, and I'm going to place it on my non-dominant hand. So that's nice and ready for me. I'm going to see where my vein is that I want to use. So I'm going to use this vein right here, and I am going to place the tourniquet on. So I'm going to do that about 2 to 3 fingers above where I want to go. So my area that I want to work with is going to be right here. So I'm going to go about 2 to 3 fingers above. So I'm going to be about right here. I'm going to have my patient hold their arm for me.
The school you were at. So I finished my program.
And I'm going to pull through just to make sure that my tabs are not anywhere near where I want to be. I'm going to take my alcohol prep pad, and I'm going to clean the area that I want to use. I'm going to use that 3 times.
There should be protections for students.
I'm going to place that off to the side.
But
I'm going to take my needle and the button side up. I'm going to flip the cap off. I'm going to hold down below without contaminating the area that I want to use. You turn the arm to the side a little bit and hold it. Thank you. So now I know where I want to go. It's going to be about here. My bevel side is up, and we're just gonna go until I get blood. And we're gonna level that out. And we're gonna press this in until it's all the way in. And we're gonna pop that back in. We're gonna put that away in our sharps right away. So now we have that. I'm going to take my tip off here, and we're going to attach.
That's awesome. You are a true dancer.
Okay. And then we're going to just pull back. make sure we still got good blood flow. That's good. And we're just gonna press all of that back in. So once we have that in, I'm gonna clip that close.
Good.
I'm gonna untwist.
That's new this year for that class.
I'm gonna make sure that this is nice and flat, and this wants to go this way. So I'm gonna hold that down.
Is uploaded.
And it's 2 parts for today.
Yeah,
And
just one
I'm gonna
that you'll see tomorrow.
tape from here over.
It'll still, the water will still come out. The ceiling will still come out again.
Okay, that's nice and taped down.
Because you want to make sure it's still still.
And then I'm gonna make sure that this is taped up so that it can be used for medication the next time. Make sure that's nice and flushed. Now that everything is taped down, I am going to just remove everything, including my chart tape. So that's all done. And I'm going to remove my tape.
Sorry, everyone. Good.
And I'm going to remove the tape opposite of the way I went in. And then I'm going to grab my gauze. And I'm going to hold down right above. And I'm just going to pull out my catheter. I'm going to use my other piece of tape. I'm going to tape that down. I'm going to hold that for about 2 to 3 minutes. And my catheter is going to go in my sharps. It's going to go in my sharps.
Yeah, just leave me. I'll go ahead. Thank you so much.
That is it. I'm going to remove my gloves, wash my hands.